Hello, and welcome to another episode of our podcast, where we delve into the important and often complex world of mental health. Today, we're diving into a fascinating and crucial topic: liability and responsibility, what mental health professionals need to know about ESA letters. This episode serves as a companion to the course offered by Therapy Trainings, designed specifically for mental health professionals, counselors, and therapists who want to deepen their understanding of emotional support animals, or ESAs, and the legal implications surrounding them. Now, if you've ever had a client ask you about getting an ESA letter, you know that this topic can spark a flurry of questions. What are the requirements for these letters? What responsibilities do we hold as mental health professionals when we provide them? And how can we navigate the legal landscape safely and ethically? In this episode, we will unpack these questions, explore key insights from Therapy Training's course, and highlight some common misconceptions that might trip you up in your practice. So let's get started. First, let's clarify what an emotional support animal is. An ESA provides comfort and support to individuals experiencing emotional or psychological challenges. Unlike service animals, which are trained to perform specific tasks for individuals with disabilities, ESAs primarily offer companionship, thereby helping to alleviate symptoms of mental health issues such as anxiety, depression, or PTSD. Now, as mental health professionals, it's essential to understand that the legal framework around ESAs is not as straightforward as one might think. This is where liability and responsibility come into play. When you decide to issue an ESA letter, you are, in fact, making a significant statement about your client's mental health condition and the necessity of an animal for their well-being. One of the key takeaways from the course is the importance of thorough documentation. You want to ensure that your clinical notes are detailed and that they reflect a clear understanding of your client's mental health status. This includes documenting the diagnosis, the rationale for recommending an ESA, and any relevant therapeutic interventions. The more detailed your notes are, the better protected you are if ever your recommendation is questioned, either legally or ethically. Let's take a moment to consider a hypothetical scenario. Imagine you have a client, Sarah, who has been struggling with anxiety and depression for several years. During your sessions, she expresses how her cat provides her with comfort when her symptoms flare up. You assess her situation, and after a thorough evaluation, you believe that an ESA would indeed be beneficial for her. You write her a letter, but what happens if someone challenges that letter? This is where documentation becomes your best friend. If you have documented Sarah's diagnosis, her symptoms, and the therapeutic relationship you've built, you can substantiate your recommendation confidently. This not only protects you, but also ensures that your client receives the support they need. Another important aspect of the course is understanding the difference between emotional support animals, therapy animals, and service animals. It's a common misconception that ESAs are the same as service animals. In reality, service animals, specifically dogs, are trained to perform specific tasks for individuals with disabilities. They have legal protections under the Americans with Disabilities Act, while ESAs do not. This distinction is critical, especially when it comes to housing and travel regulations. For instance, under the Fair Housing Act, individuals with ESAs may have certain rights to live with their animals in no pets allowed housing situations, as long as they have a valid ESA letter. However, it's vital to communicate to your clients that ESAs do not have the same access rights as service animals in public spaces like restaurants or stores. This is a point that often leads to confusion and frustration. So being clear with your clients can help manage their expectations. Now let's touch on the responsibilities that come with issuing ESA letters. When you sign an ESA letter, you are essentially vouching for your client's mental health needs. This brings a certain level of responsibility. It's crucial to ensure that your client's need for an ESA is genuine and that they understand the commitment involved in having an animal. This includes considerations such as the financial burden of care, the time commitment, and the emotional readiness to handle the responsibilities of pet ownership. Here's where ethical practice comes into play. As mental health professionals, we have a duty to act in the best interest of our clients. This means conducting thorough assessments, understanding the nuances of their needs, and being honest about whether an ESA is indeed the appropriate course of action. If you feel that an ESA may not be the answer, it's your responsibility to have that difficult conversation with your client. Let's consider another example. You might have a client who believes that getting a dog will solve all their problems. They're excited and have already picked out a breed. However, upon further exploration, you discover that this client has a history of impulse control issues and struggles with managing responsibilities. In this case, it might be more beneficial to redirect the conversation towards coping strategies and support systems before jumping into the ESA recommendation. Now, let's address some common misconceptions about ESA letters and their issuance. One prevalent myth is that anyone can get an ESA letter by simply asking for one. While it might be true that some websites offer quick and easy letters for a fee, as mental health professionals, we know that this is not an ethical practice. The ESA letter needs to come from a licensed mental health professional who has a genuine understanding of the client's condition and needs. Another misconception is that clients can use ESA letters to bypass pet restrictions in all situations. As mentioned earlier, ESAs have specific rights under the Fair Housing Act, but do not enjoy the same access under the ADA. Clients often need to be educated on this distinction to prevent misunderstandings and potential conflicts. As we wrap up today's discussion, it's essential to remember the profound impact that emotional support animals can have on individuals struggling with mental health challenges. While the process of issuing ESA letters comes with its complexities, the potential benefits for your clients are significant. In conclusion, I encourage all mental health professionals to take the time to familiarize themselves with the legalities and responsibilities surrounding ESAs. Therapy Trainings offers a wealth of resources, including the course we discussed today, that can provide you with the knowledge and tools necessary to navigate this area of your practice. So, if you're looking to deepen your understanding and enhance your skills, I highly recommend visiting therapytrainings.com. There, you'll find not just this course, but a variety of other valuable training opportunities designed specifically for professionals like you. Thank you for joining me today as we explored the nuances of liability and responsibility in relation to ESA letters. Remember, the work we do has the power to change lives, and being informed is a crucial part of that process. Until next time, keep learning, keep growing, and keep supporting your clients in their journeys toward healing.